Good morning. My name is Dr. Abiola Olusegun. I'm here today to discuss about the major causes of female infertility. When it comes to infertility, the women are always the ones that will be blamed. Men don't actually believe that they have any issue that can cause infertility, though it's much in women than men. So that's why we're going to discuss female infertility today. Then later on, maybe another day, we can discuss the male infertility. So today we are discussing the major causes of female infertility. Now, infertility is defined as trying to get pregnant with frequent intercourse for at least a year with no success. That's when you are having intercourse every day or maybe 3 times in a week for a complete year without prevention. And in this intercourse, there is nothing like pregnancy for a year. That's when you can say, okay, the woman is suffering from infertility. But if you just get married, maybe within few months, you don't need to disturb yourself for that yet, except there is an issue already. So, and at times, female infertility causes can be difficult to diagnose, but there are many available treatments which will depend on the cause of the infertility. And the main symptom of infertility is the inability to get pregnant. That's just the main symptom. So at times, a menstrual cycle that's too long, maybe 35 days or more, or too short, maybe less than 21 days, or irregular or absent, can mean that you are not ovulating. And when you know that when there is ovulation disorder, there will be infertility. It is still part of what we are going to discuss in the major causes. So, but there may be no there may be no outward signs or symptoms. So now let's go to the major causes of infertility. I talked about painful and irregular periods, and this can give an indication of female infertility, but many women have no symptoms until they try to conceive. So fertility testing for both partners together is in fact, it is okay. When you want to do fertility test, maybe before marriage, it is better to do for both partners. Not that only the woman will do and the man will not do. I told us that though it mostly occurs in women, but it happens in men too. So I told us that painful and irregular periods may give an indication of female infertility, though many women does not have the symptoms until they try to conceive. So, and I told us that fertility testing for both partners is highly recommended because only 1/3 of infertility cases are caused by female factors, and 1/3 are male, and the remainder a combination of factors, or the reason is unexplained. And there is another one that is endometriosis and PCOS. These are also among the common reasons of female infertility, and this includes ovulatory disorders, poor egg quantity or absence of eggs, blocked fallopian tubes, endometriosis, physical problems with the uterus, then unexplained infertility. Now let's go into them one by one. Ovulation disorders. Ovulation problem occurs when a condition, usually hormonal, prevents the release of a mature egg from an ovary. It occurs when there is hormonal imbalance. There are 2 hormones, follicle stimulating hormone, that is FSH, and luteinizing hormone, that is LH. These 2 hormones are responsible for stimulating ovulation every month, and production of these hormones can be disrupted by excess physical or emotional stress. So that is why at times when a woman goes through physical or emotional stress, it causes infertility. And a very high or very low body weight causes the imbalance of these hormones to a recent substantial weight gain or weight loss. So mental stress, which often leads to emotional stress, is becoming a major factor. Just knowing she's under pressure to conceive, if not, the husband can marry another woman, that alone can prevent pregnancy. That is why when a woman gets married, don't let that anxiety come in, that immediately after marriage I must get pregnant, I must this, I must that, or maybe you start giving yourself unnecessary stress that his family will complain and all that. That anxiety alone, that stress, that mental stress, emotional stress alone can cause infertility. You might be expecting that pregnancy at all costs, and it won't come. And maybe you are scared that if you don't get pregnant on time, your husband will marry another woman. No, that alone can cause infertility. So please don't put yourself under stress, either emotional or physical stress. And there are other factors that can cause this, that can cause ovulation disorder, underactive thyroid or pituitary gland disorder, which can cause excess production of prolactin. In some women, they see something like milk, like white fluid in their breast when they have excess prolactin. So when you have underactive thyroid or pituitary gland disorder, this can cause excess production of prolactin, and this can lead to infertility. Then there are some medications also that can cause ovulation disorder. Medications like steroids or insulin may also affect the hormones. And when you have ovulatory disorder, there are some symptoms that you can see, like absent periods or infrequent period with excessively heavy or light bleeding. The bleeding can be excessively heavy, or it can be excessively light. So please don't put yourself under stress. And whenever you are taking medications like steroids or insulin, you know that it will affect your hormone. The hormone must be balanced. I told us that when hormone is not balanced, that is when there is ovulatory disorder. And you can go for diagnosis when you are feeling these symptoms. There are some diagnoses like blood tests to determine the hormone levels. So you can go for that kind of diagnosis. And there's another cause, that is PCOS, polycystic ovarian syndrome. We call it PCOS. This is a common cause of irregular period, and it is caused by a hormone imbalance too. Hormone imbalance disrupts ovulation. So PCOS is when your hormone is not balanced, and the ovaries develop many small cysts instead of ripening and maturing one egg each cycle. Although women with PCOS may have high body mass index, that is BMI, and not all these conditions, not all of them have overweight. It's not all the women that have polycystic ovarian syndrome have overweight, but they usually have high body mass index. And there are some symptoms they feel to know when you are feeling irregular menstrual periods, when you have excessive hair growth, when you have acne, and when you have weight gain. You might be suffering from PCOS, polycystic ovarian syndrome. So you can go for scan. They scan the ovaries, and you can do hormone testing. Those are the diagnoses you can do to know if you are actually suffering from PCOS. Then there is another major cause, that's poor egg quantity. Though age is the biggest factor, as egg quantity and quality decline significantly with age from late 30s. There are some, when they don't get married on time, when they have late marriage, they do have, as they age, they have poor egg quantity. So although this may also be an issue for younger women when eggs are damaged, maybe when they are undergoing chemotherapy or when they develop chromosomal abnormalities. So it can also happen in younger ones, but it happens mostly in older women above 30s. And there are some symptoms that you feel when you are going through this. I told us before that the main symptom of infertility is when you are not able to conceive. So the symptom of this one is difficulty conceiving or recurrent miscarriage. When you are having miscarriage, you get pregnant, you have miscarriage. So that is the symptom of this, and the diagnosis for that is AMH, that's anti-Mullerian hormone test. So that's a substance produced by small ovarian follicles, and in a natural conception, one of these follicles will mature to become an egg. So AMH test is commonly used to assess the number of eggs available and to predict response to ovarian stimulation. So when you go for this test, you will be able to detect if you are suffering from it. And although it is not a measure of egg quality, but if more eggs are available, there's a greater chance that one will be sufficient quality. So you can go for that test. And research has shown that the number of the growing follicles is related to the size of the pool of remaining primordial follicles, that's microscopic follicles in deep sleep. So therefore, AMH blood levels give an indication of the remaining egg supply or ovarian reserve. But as the release of eggs is not consistent, the AMH reading should not be used to predict future fertility. Or at least you can still go for it. But women with small many follicles, such as those with polycystic ovaries, they have high AMH hormone values. And women that have few remaining follicles and those that are close to menopause have low AMH levels. So let's move to another major cause: blocked fallopian tubes. In fact, this is one of the most things that happen to women, because the egg travels from the ovary to the uterus through the fallopian tube, and if the tubes are damaged, they can become blocked. So the sperm is prevented from reaching the egg and fertilizing it, since the tubes are damaged or blocked. Blocked tubes can be caused by pelvic inflammatory disease. When you have inflammatory disease, especially when you did not treat it, when it has been there for a long time, it can cause blocked fallopian tubes. Also, sexually transmitted disease such as chlamydia and previous sterilization surgery can also cause blocked fallopian tubes. And there are some in blocked fallopian tubes, there's really no symptoms. The women don't feel any symptoms for blocked fallopian tubes, except when they are trying to conceive and it's not forthcoming. So they go for scan and they see that they have blockage in their fallopian tubes. And the diagnosis you can also do when you see that you want to conceive and it's not coming up, you can do ICOSI diagnostic test. That's when a dye is inserted into the tubes and followed using an ultrasound scan. So you can do that. And if the dye travels through the tubes to the uterus, then tubal patency is confirmed and the tubes are clear. But this test can be performed at any time of the cycle if the couple have not had unprotected sex. That's when it can be performed at any time of the cycle. So when you see that you are considering and it's not forthcoming, it might be blocked fallopian tube, but you might not feel the symptoms. So it is better to go for scan, to go for the diagnosis in order to be sure. Then another major cause is endometriosis. Endometriosis, this is a condition where the endometrial tissue, that is the uterine lining, that sheds with each monthly period when it grows outside the uterus. So when the endometrial tissue, they are supposed to grow, they are supposed to be inside the uterus, are now growing outside the uterus. That's the case we call endometriosis, and it is an important factor in infertility because it can cause tubal blockage and it can also cause ovulation problem. So it is an important factor when it comes to the causes of infertility in women, and it is a common cause because it causes ovulation problem, it causes blocked fallopian tubes. So when you are suffering from this, there are some symptoms you might be feeling, like painful periods and deep pain during penetrative sex, chronic pelvic pain, painful bowel motions, or urination during menstruation. So those are the symptoms you can feel when you have endometriosis. But in some women, there may be no symptoms other than difficulty in getting pregnant. So, or it is better to go for diagnosis to be sure. The diagnosis for this is laparoscopy. It is used for both diagnosis and treatment if the tissue is seen to be blocking the tubes. So that can be used for both diagnosis and the treatment. And there is another major cause, which is uterine or cervical cause. A normal uterine cavity, that's the womb. A normal uterine cavity and endometrial lining is essential for a woman to be able to conceive and carry a pregnancy to term. So if there is uterine or cervical causes, it is impossible to get pregnant. And there are some conditions like congenital abnormalities. That's when you are born with it. That can also impact the uterus and the cervix. Or in some countries, health professionals still check the cervical mucus, but in Nigeria and some other countries, it is no longer considered relevant because IVF and IUI treatment have overcome any issue with the mucus. But we take care of that in African herbal medicine perfectly with some herbal recipes. So there is another major cause, which is fibroid. In fact, this is common. It is common. Most people know about it. Most people are suffering from it, through lifestyle, or maybe when they have fibroid in your family. So it can make you have fibroid, but your lifestyle too can make you develop it. Because fibroid are non-cancerous growths that develop in or around the womb. So that they develop in the uterus or they develop around the uterus. They do not always cause problem, but it depends on where they are located and their sizes. Because fibroid can be one, it can be more than one. But for you to have any difficulty with fibroid, it depends on where they are located and their size. We have different types of fibroid. We have submucosa, pediculated fibroid, and so on, subserosal fibroid, and so on. So it depends on their size and their location. There are some women that their fibroids may be big, and there are some women they don't even believe that they have fibroid even when they do the scan, just because they are slim. So they'll be like, where does fibroid want to stay in my body? But when you have a family history of fibroid or your lifestyle, it can help you. It can make you develop fibroid. And you know that fibroid are made of muscle and fibrous tissue, and they can vary in size. And it is thought that their formation is linked to hormone estrogen and at times genetic causes. When they have it in your family or your lifestyle, maybe you have imbalance in hormone, the estrogen is much, it can cause fibroid. They also call it uterine myoma. Maybe when you do scan and you see that they wrote uterine myoma or leiomyomas, know that it is fibroid. And the symptoms, many women are unaware that they have fibroid because they don't have symptoms until it becomes so big. That's why I said for you to have any difficulty when you have fibroid depends on the size and the location where the fibroid is growing. So there are so many women when the fibroid gets so big that they feel the symptoms. Maybe they are feeling some kind of symptoms and they go for scan. And symptoms in about 1 in 3 women include heavy periods, painful periods, lower back pain or discomfort during sex. That is when some women see that they are having some difficulties, then they go for scan. But it is not in all women that the symptoms always show, and in most women it is when it is big, when the size is big, that is when they feel the symptoms of maybe lower back pain, painful period, heavy period, pain or discomfort during sex. That's when they have. And the diagnosis you can do is a routine gynecological examination or scan. So there are other causes of infertility like infection, oral hygiene, adverse effects of certain drugs, brain tumor, maybe pituitary gland especially, etc. So those are also causes of infertility when you have infection that you've not treated for a long time. And there is another one that is unexplained infertility, because sometimes the reason for the infertility cannot be detected, and for minority of people it is found that the egg and sperm are incompatible, that when they put them together they cannot form an embryo. But however, the latter can be overcome with intracytoplasmic sperm injection, that is ICSI, or an IVF technique in which an individual sperm is introduced directly into an egg cell. So that can be overcome. But I used to recommend comprehensive fertility testing depending on which is available as a suite of tests or individually to assist the diagnosis. And it is highly recommended that both partners are checked at the same time, because this may also help to reveal a male infertility issue also, if the man is also suffering from infertility. And there are some things they do, like screening for infection, blood tests for hormone levels and ovarian reserve, ultrasound scans, tuber patency assessment, semen analysis, and so on. So depending on the test outcome, patients will be treated accordingly. We treat with herb, but depending on the test outcome, the patient will be treated accordingly, because we must know the causes of the infertility. And there are some things you need to do at least to prevent the infertility, or to work on yourself when you know that you are expecting. You need to make sure that there's lifestyle changes, like adjusting your nutrition as the case may be. So in order to get pregnant, there are some essential factors that are needed apart from you changing your lifestyle. You know that when you want to get pregnant, there are some things that need to be put in place, like you need to ovulate. To get pregnant, your ovaries must produce and release an egg. That's a process that we call ovulation. So your doctor can help you evaluate your menstrual cycle and confirm your ovulation. And another one is your partner needs sperm. For most couples, it is not a problem unless your partner has a history of illness or surgery, and your doctor can run some simple tests to evaluate the health of your partner's sperm. Those are the things that need to be put in place. And again, you need to have regular intercourse during your fertile time. Doctor can also help you better understand when you are most fertile, and you need to have opened fallopian tubes and a normal uterus, because the egg and sperm meet in the fallopian tubes, and the embryo needs a healthy uterus in which to grow. So for pregnancy to occur, all this must be put in place, and every of the human reproduction process has to happen correctly. That is, one of the two ovaries releases a mature egg, the egg is picked up by the fallopian tube, sperm swim up to the cervix, through the uterus and into the fallopian tube to reach the egg for fertilization, and the fertilized egg travels down the fallopian tube to the uterus, and the fertilized egg implants and grows in the uterus. So all these things have to be put in place. And in women, those major causes we have mentioned earlier, like blocked fallopian tube, endometriosis, ovulation disorders, infections, and so on, all those causes we have mentioned can disrupt the process at any step. So you need to check yourself, go for diagnosis, know the causes of your infertility among all those causes we have mentioned. So for women thinking about getting pregnant soon or in the future, these tips may help optimize fertility, like maintaining a normal weight, quit smoking if you are the type that smokes, avoid alcohol, reduce stress, limit caffeine. All these things can help you out when you want to conceive. So please, if you know that you are expecting but it is not forthcoming, please go for diagnosis. I've mentioned the major causes and I've mentioned the diagnosis that you can do, the scan, the hormonal blood testing. So just go to your doctor, complain to your doctor, do the diagnosis, know the causes of your infertility, so that you know the treatment to be done. So we treat with herbs and we treat perfectly in Embee Holistic Care. And if you have any question or any contribution, or you want to speak with a doctor, you can contact on 081 0460 7130 08104607130. And you can drop your question on our social media, on Facebook, on Instagram, on Twitter at Embee, and drop your question there. We'll answer you as soon as possible. And if you want to visit our clinic, it is located as number 51 Abiodun Oshudiya Street, Meron, Agbadoja, Lagos, close to Abulegba. So we'll be expecting your comments, your questions, and we'll answer you as soon as possible. And we will implore you to like and share this message, this lecture, so that the people also suffering, or people that are thinking of getting pregnant soon in future, can also benefit. They can also know how to prevent, and those that are also suffering from infertility can also know what they are to do in order to overcome it. So you can reach us on our social medias. I've dropped our address. You can reach us there, and the contacts. If you want to speak with a doctor, you can also contact us on that number. Thank you for listening today, and we'll have another lecture on Monday, but it will be communicated to us. So see you then. Bye.